As a resilience leader, it may be up to you to make the decisions on reopening in the midst of the ongoing COVID-19 pandemic. With the health of both your business and employees at stake, the choices you make now will have far-reaching consequences. You and your team will need to answer many fundamental questions to protect your organization and its workforce. Today, we'll get some answers. Hi, I'm Russell Wooldridge, Senior Director of Business Development for DRI International, welcoming you to the latest of our webinars focusing on the challenges of the COVID-19 pandemic and what it presents in the resilience field. Today, we're looking at how to safely return to the worksite during a pandemic with Dr. Lisa Kooning. Dr. Kooning founded Health Preparedness Partners, LLC, after a 30-plus year career with the U.S. Center for Disease Control and Prevention, where she led the development of national pandemic influenza preparedness and response plans and policies. She also served in leadership positions for multiple national and international emergency responses, conducted large format exercises, and consulted with organizations across all sectors around the world to improve emergency preparedness. Dr. Kooning, thank you so much for joining us today.
Thank you, Russell. It's a pleasure to be here today to talk about returning to the worksite during the COVID-19 pandemic. On today's webinar, I'll cover a short update of the pandemic, review the framework for returning to the workplace, and talk about the needed planning that we all need to do for the duration of the pandemic. So first, an update. Where are we now? As of the time of this recording, there are over 10 million cases of COVID-19 in the U.S. and almost 240,000 deaths. Over the past 4 days, unfortunately, we have seen about 100,000 people become ill with this disease in the U.S. On March 11th, the pandemic was declared. Look at the distance we've traveled since then. Cases are climbing every day. Every state is affected, not all at the same time and in the same way, but no place has been spared. When we think about moving forward, there's a number of things to think about. First of all, the vaccine timing. Despite all the accelerated efforts and the great news that we've been hearing, we really don't know when vaccine is going to be widely available. There's lots of new evidence. We've learned so much about this virus, but there's still so much we don't know. But what we do know is that distancing, covering our face with a mask, and hygiene protocols are working in places where people are using them consistently. And the level of risk, even though we are doing all of our mitigation efforts, we will not be out of the woods until we have a safe and effective vaccine that's been widely distributed. Let's drill down a little bit more on vaccine. What we know now is that there are a number of vaccines in the testing phase, 6 of them in the last phase that are in the US. 4 of them are in phase 3 trials. And just recently, Pfizer announced the preliminary results of their phase 3 trial with 90% effectiveness. However, to date, no vaccines have been approved or authorized for use in the US, and we all are waiting anxiously for that to happen. Again, there's so much to learn about COVID, and there's so much that we've learned. What we know to date is that outdoor gatherings are safer than indoor, that mask and distancing work, but they're best used when they're deployed together. Although there was some concern about weather and how it would affect the spread of the disease, we've seen that weather has had a minimal impact. However, as we head into winter and more people are indoors, we do worry about increased transmission. At first, in the pandemic, older populations were most impacted, and very few children and younger people were affected. However, over the summer, we have seen the rate of infections in people 18 to 29 years old grow, and in fact, that age group is the highest now. However, people who are older than 65 and who have underlying conditions remain at significantly increased risks. We also have learned that there's a large proportion of people who are infected who have absolutely no symptoms, and therefore you cannot look at a person and tell if they're infected with this illness. And the other thing we're learning is that there are some longer lasting effects after a person has recovered. Now, there's still plenty we don't know. We don't know how long this pandemic is going to last, when it's going to peak, and when subsequent waves will hit. As I said, we also don't know the exact availability of COVID-19 vaccine, although the progress that's being made is extremely exciting. We also don't know the effectiveness of that vaccine overall, and it's important that widespread vaccination occur to afford community-level immunity, and so that we can start getting back to normal. We don't know if this virus could change and become more serious or dangerous. And we don't know how long immunity lasts after a person has been infected. And finally, even though we're discovering that longer lasting effects are emerging, we don't know what's going to happen over time and how long those effects will remain. Sorry to show you this picture, but it really adequately shows how a person can spread COVID-19 when they cough or sneeze. Droplets are expelled from the nose and mouth, and those droplets contain the virus. And those droplets are usually large, relatively speaking, and don't travel a long distance. However, one of the things that we've been learning is that in addition to those large droplets, there's also some tiny particles that are produced when a person coughs, sneezes, or talks, or sings. And those tiny little droplets can be suspended in the air for a longer time and travel further than the heavy droplets. So what does that mean? That means that those tiny droplets can waft in a room, particularly if someone is indoors, and that a healthy person can breathe those droplets or that aerosol particle in their respiratory system and become infected. And that's why it's so important to wear a face covering or a mask. And this picture demonstrates the reduction of risk when the person who is sick is wearing a face covering and when the healthy person is wearing a face covering. There's some new data that's being released today that explains how this works and improves our understanding of how face coverings protect the person who's wearing it and protects others. So, taking all of that into account, how do we plan to return to the work site? And when we think about returning to the work site, we know that business continuity professionals already have business continuity plans for their businesses. You don't need to start from scratch. The planning that's needed for return to the work site can serve as an annex to your business continuity plan that already exists. But first of all, think about the work site and what is the role of the work site. This pandemic has given us the opportunity to telework in many cases, to think about how we use the workplace. We're probably going to be affected by this pandemic for a long time. Experts have judged that we will not have community level protection, even with a well-matched vaccine, until late into 2021. So what does that mean? And how do we use the work site in the interim? Can it be used as a resource center, a place where small groups of employees return for short distanced meetings where everyone is wearing a face covering, or training sessions? I don't have the answers for that, but I do want to ask you to think thoroughly about what you need in terms of the work site and when you need to return. And when you're thinking about it, how do we know when we can return safely? What are the most effective ways to protect our team and our customers? What are the key parameters that inform return to the worksite decisions? And how should we interpret and apply emerging evidence and public health guidance? These are all complex questions. And in an effort to make things a little bit easier, we've developed a return to the workplace framework that has 6 components. Let me go over each one of those components now, starting with public health policies. Public health policies govern whether we can return to the work site at all. State and local public health officials have issued business reopening stages and policies, and it's very important that you do not exceed or preclude those stages or policies. It's important also to continuously monitor local public health where each of your business units are located, because those policies can change rapidly, particularly now as we're seeing an acceleration of the illness. The second component is closely monitoring pandemic trend in the county and state where the business is located, and also monitoring pandemic trend where employees reside. We advise that return to work should only proceed when there is not an active acceleration of disease. And what we recommend is that you find a resource that you can monitor on a daily basis. Focus on where the business is located and where most of your employees live. Assign someone to monitor the trend every day and track that progress. What you're looking for is at least a 14-day consistent decline. We do not recommend returning to the workplace when there are new cases that are emerging every day that are increasing in volume. And then, of course, be prepared for change, because this is a highly dynamic situation. So how do you monitor trend? Well, there's a number of reputable groups that track the pandemic every day, including, first and foremost, state and local public health departments, CDC, the Johns Hopkins Center for Systems, and the Harvard Global Health Institute. Currently, Harvard is leading a consortium with other reputable groups that have joined them to create the COVID risk level map, and they are conducting daily assessments in every county in the U.S. and translating those assessments into a risk assessment. Their work can provide the daily assessment that businesses need to conduct. So several important things when trying to measure the progress of a pandemic. First of all, the number of cases per day informs us as to whether the pandemic is getting worse or declining. However, the raw numbers vary a lot because some jurisdictions do not report cases consistently, and we usually see fewer cases reported over the weekend. Therefore, most experts use a 7-day rolling average to monitor pandemic trend. If we use a 7-day rolling average and we base it on cases per population, this method allows us to compare one jurisdiction to another. So there also needs to be a way to categorize pandemic risk. So the Harvard-led group created a color-coded rubric. So we think it could be a very useful way to monitor trends in your area. What we see is that cases are characterized by 4 color-coded levels: red, orange, yellow, and green. We recommend that counties that you are monitoring be consistently in the yellow category before the initial return to the workplace. Now, there's a number of ways of doing this, and this is only one suggestion, but hopefully it gives you a starting point for thinking about when it might be safer to return to the work site. Pandemic trend is very important along with policies, but our employees must be ready and willing to return to work. So the third component is employee readiness. We recommend that you periodically survey or assess employee sentiment about returning to work to identify concerns and challenges. But it's also important that your workforce are educated about the pandemic. And your role in providing that education is very important. It's also important to let your workforce know what you're doing to prepare for return to work and how the business will take steps to protect the workforce once people are back at the work site. The fourth component are business realities. And what we're asking for here is for you to assess what the risks and opportunities are of staying closed versus opening. This is an opportunity to highlight your business continuity efforts, identify the major role of the work site, and determine the factors that create a compelling reason for return to work. It's also an important time to identify barriers for the business in returning to work. The fifth component is one of the most challenging, and that is physical site readiness. Just because the pandemic may be subsiding and our employees are willing to come back to the workplace and business realities point to advantages of doing so, there's a lot that needs to be done at the actual work site before we can bring anyone back. And this part takes a good bit of time. There may need to be rearrangement of workstations, a planning for cleaning and disinfection, building issues such as the ventilation system, water systems, and how traffic and people will move through the lobby, elevator, and stairwells. Whether there will be screening at the door, and in some jurisdictions mandate that people are temperature screened and queried at the door for symptoms. And then there's much more. I won't go over each one of these, but just knowing that putting together a plan for physical site readiness will be the time-consuming and most important part of your return to workplace efforts. The final component is one that deals with the external environment, and that is community status. It's important to assess transportation and the commute. How does your workforce get to your work site? Are they using mass transportation? If so, there may be some reservations or limitations in doing that during the midst of a pandemic, as well as this unpredictable weather season that we're having now, wildfires, tornadoes, and other emergencies. Unfortunately, we've also seen civil unrest and disruptions that could impede return to the workplace. And if there is a robust seasonal flu outbreak, that could also affect your plans, as well as other factors. While I'm talking about seasonal flu, I really need to focus on that for a minute. You know, people generally think that the flu is a pretty benign condition, but it affects millions of people every year. We've seen a lot of people become hospitalized, ill, and unfortunately die from seasonal flu. And flu season is actually started in the US. It starts usually in late October and can affect people all the way through next spring. The issue is that the symptoms of influenza are so similar to COVID-19 that you cannot tell the difference by just looking at a person. And therefore, if someone is exhibiting flu symptoms in an office or workplace setting, that could set up a whole cascade of events that would cause the employer and others to fear that that person had COVID-19 when actually they had influenza. Now, the good news is, so far this season, the rates of flu have been really low. And unlike COVID right now, there is an effective vaccine. And that vaccine is widely available at doctors' offices, clinics, and pharmacies all over the country. It's really in the business's best efforts to promote flu vaccination and flu prevention right now. It will certainly help your re-entry plans and will protect your workforce against influenza. So, in summing up our discussion about return to the work site, you can see that there are a number of components that have to be simultaneously considered in order to make decisions about when and how to return to the work site. We would call that using a layered approach, meaning deploying multiple strategies at the same time. If you would humor me, I consider this like Swiss cheese. If we have one slice of cheese, it's got lots of holes in it. But if you layer one slice on top of the other, the solid places in one slice block the holes in the slice below. So, by bundling multiple strategies together, we can get a synergistically more effective strategy than just using one thing at a time. Now, switching gears a little bit, although we've talked about return to the work site, there's a lot more planning that we need to do because this COVID-19 pandemic is going to last for a good bit more. So how do we plan for the duration? First of all, just to let you know, pandemics come in waves. The 1918 pandemic had 3 waves, one in the spring of 1918, the largest wave in the fall of 1918, and then another wave in the spring of 1919. In 2009 pandemic had 2 waves in the US. Again, one in the spring and one in the fall. And as I showed you before, we are now approaching a 3rd wave of this pandemic in this country. And until we have an effective vaccine, there really isn't a way that we can stop this pandemic in its tracks. So we have to learn and cope with it, wait for a vaccine, ensure that everyone who can become vaccinated becomes vaccinated. And in the meantime, we can focus on what we can do in our business to protect our workforce and our customers. In 2005, a national strategy for pandemic influenza was released. And even though this is dated and old, it did specify roles for employers. And I think the 3 roles this specify are really still relevant today. First of all, protecting the health of the workforce, keeping businesses operational, especially those essential and critical businesses, and assure functioning of communities. There are several domains for planning. The first is business continuity, protecting the workforce, protecting customers, and all of this within the context of community planning and being in a community setting. Let's look at each one of these. In terms of business continuity, we know that you have robust plans, but those plans may need to be altered, particularly as we go forward in this pandemic with accelerating cases. We need to be prepared for continued intermittent school and child care closures. Even though our workforce may be teleworking, those are big challenges for them. We need to monitor local policies regarding community gatherings. It would not be unlikely, as cases increase, to see more limitations on the number of people that can gather. It would be wise to procure sufficient face coverings and cleaning supplies now in preparation for reopening, and ensuring alternative supply chains, because we definitely saw supply chain disruption this spring and summer. Identifying priority services in case this pandemic endures for a long period of time, and preparing for ongoing financial impacts. In terms of the workforce, utilizing a return to workplace strategy, ensuring that HR policies continue to support pandemic strategies, and that includes sick leave and other leave policies, continued communication with the staff, and when a COVID vaccine is available, encouraging uptake in that vaccine. If possible, sustaining telework, and thinking about when you do return to the workplace, how you factor in plans for employees who may be at higher risk for complications of COVID, and then planning to provide employee assistance. This pandemic has provided a lot of stress to families, workers all over the country. Some people are faring better than others, and some need help right now. In terms of customers, consider the issues with customer exposures and protection as part of the return to workplace strategies, minimizing close contacts between customers and employees, communicating with and educating customers, and being ready for more fear and anxiety as misinformation could increase as vaccine is released, and potentially community disruption. In terms of community, it's important that there's a contact point between the business and public health. With the recent elections, we may see new people appointed in leadership roles in public health, and so those relationships may have to start all over again. It's really important that the business have credible sources of information, local sources of information, because public health recommendations are going to govern how we manage our reentry and how we manage sick persons at the workplace. It's also important to explore access to community resources for response and recovery. And yes, we will get there for recovery. A plan on a piece of paper and a notebook on the shelf, as you all know, is not effective until it's been tested. You will have to develop a significant number of new policies and procedures as you plan to return to the workplace. It's important that you test those policies and procedures by using a workshop, a tabletop, or a simulation, and then use the findings from those exercises to refine and improve your plans. So let me sum up. A successful COVID re-entry to the workplace response requires a number of things. First of all, an informed leadership. Leadership must know what's going on within the business, but not only that, within the county and the state and the community where the business is located. Continuous planning is needed. Even though we're in the midst of a response, we have to stay one step ahead and continue to plan. Communication, very important, with our staff, with our vendors, with our stakeholders, and with our communities. Adherence to multiple strategies. The only way that we're going to get through this pandemic is to use the science-based strategies that are recommended by public health. And right now, that has to do with physical distancing, face coverings, hand hygiene, cleaning protocols, and not crowding in indoor spaces. Flexibility. We have seen that this pandemic is unpredictable. We really have been caught off guard a number of times, and therefore our plans need to be flexible enough to bend and shift when we learn more information. And finally, action. It's not enough to sit on the sidelines and let this pandemic roll over us. We have to take action proactively to protect our workforce, our customers, and our communities. Thank you so much for attending the webinar today. I'll be happy to answer your questions if you'd like to send me an email or reach out to DRI. Again, thank you so much for your attendance. Well, a number of you submitted questions when you registered for this webinar, so I'm going to go over them now. I'll read the question first and then give you the answer. So the first question is, how much difference does it make which type of mask one wears, whether it's cloth, medical, K95, or so forth? So first of all, let me say that CDC has changed its guidance very recently and is now proposing that the purpose of wearing a face mask are not only to prevent other people, but also to prevent the wearer. The face mask works to prevent the spread of exhaled air and respiratory droplets when a person is breathing, speaking, singing, coughing, or sneezing. CDC recommends that everyone should wear a mask in public settings and when around people who don't live in their household, especially when other social distancing measures are difficult. There have been several recent studies that have compared how well different masks block the release of respiratory droplets and particles. And these studies have found that overall, surgical masks, unvented K95 respirators, and multi-layered cloth masks that are made of polypropylene, those are the ones that seem to do the best job. Cotton masks, neck gaiters, and bandanas in particular are not as effective. The next question was, do you have any recommendations for application in geographically dispersed organizations? So, as we discussed, the pandemic is affecting different places in different ways and at different times. So it's important that every business unit that you have recognition of what's going on in that area regarding the pandemic trend and policies. So we would recommend that you establish a focal point at each one of your business units. The next question is, we are living through unprecedented times where federal mandates on lockdowns are not a priority. How do businesses who have been severely impacted by COVID-19 effectively reopen when mitigation strategies such as NPIs, environmental modifications like plexiglass, and PPE may be expensive to obtain, but they also might be some of the most effective ways to reduce transmission? Well, that is a very complex question, but let me try to answer it. First of all, if local jurisdictions have mandated stay-at-home orders, have asked non-essential businesses to stay shut, and have restricted movement in the community, then it's important to adhere to those policies. We would recommend that you align your strategy with the local policies. And then once local policies allow return to the workplace, you need to carefully evaluate how and whether you can sustain business operations remotely and whether you can get back to the office. Some businesses can operate very effectively with only a few key staff returning to the worksite and everyone else working remotely. And the cost of PPE and worksite modifications can be significant, but they also can be factored into your decision about when and how to return to the worksite. Providing face coverings and using social distancing is very important when returning to the worksite, and those policies need to be practiced. So the next question is, during a recent survey, most of my employees would like some remote work schedule when things return to, quote, so-called normal. Do you anticipate that ISP will become critical infrastructure and resilience will be more about supporting remote users? Thanks. Well, a number of businesses are considering a hybrid model, similar to what I just said on the last question, but that includes that some employees always work from home, others may be in the office, and then others yet may include some work days at the work site and others during the week by teleworking. I think one surprise from this pandemic is the discovery that many businesses, but not all, but many of them have found that teleworking went pretty well and better than expected. But one thing that the pandemic has showed us with teleworking is that internet connectivity is a key part of this country's infrastructure, but it's not universally available or accessible. In fact, a recent FCC report found that about 19 million Americans, or 6% of the population, still lack access to fixed broadband service. And overall, a study by Pew that was conducted in 2019, so it's a little out of date, found that about 3/4 of American adults have broadband service at home, but there are those that don't. So if you have employees who do not have access to reliable broadband, then their ability to telework is going to be hampered. Some employers are providing hotspots or stipends for broadband service to employees who need to telework but who don't have access. Our next question is, are we ready and prepared for a second wave? Well, I think by looking at the pandemic trend that we're actually headed for a third wave of this disease. And unfortunately, this wave looks larger than previous ones. For the past 6 to 7 days, we have seen over 100,000 people in the country become diagnosed with COVID-19. And many communities are finding that their hospitals are struggling to meet the demand. So actually, we're looking at a situation that could be worse this winter than the past summer and spring. Until we're able to build community-level protection and immunity through a safe and effective vaccine, we're going to have to double down on other mitigation measures, including face coverings, distancing, hand washing, avoiding crowded indoor settings, and so on. We're very worried that without an availability of a safe and effective vaccine, if the public does not use those measures, we're going to see very high disease rates. And that would mean very high hospitalization rates. And unfortunately, we would see high death rates. I mean, the good news is that we have seen that mask wearing and social distancing can be effective. One study through a modeling technique estimated that if 85% of the public wore a mask and social distance when they were outside of their household, that almost 100,000 lives could be saved. Another study predicted that even with 75% of the population wearing masks, that we could reduce hospitalizations by 44% and reduce deaths by 47%. So even though we may be headed into a difficult time, there are things that we can do. And of course, in the other good news category is that a new therapeutic monoclonal antibody medicine was just given an emergency use authorization by FDA to treat people who have moderate and mild disease. And then the early findings from the phase 3 trials of the Pfizer COVID vaccine look very promising as well. The next question is, recognizing that there's not a one-size-fits-all plan for returning to the office, what is your view on industries that should be considering a more rapid return than others, based on the data we have available to us? Well, what I would say to that is the key factors that will influence decisions about returning to the office include not only the 6 parameters that I reviewed in the webinar, but also whether the business provides a critical or essential community function, whether the business can perform its highest priorities remotely or must be in the work setting to do that, and also the willingness of employees to return to the work site. Our next question is, I would like to have more details around those who have been determined to be in close contacts and quarantine requirements. CDC and Public Health states 14 days from the last contact. Can testing efforts come into early returns? So CDC has currently updated its guidance and is actually looking at that 14-day period to see if that still holds. But in the meantime, they currently advise that people who have been in close contact with someone who has COVID needs to stay home and away from work and others for 14 days after their last contact. And that close contact is defined as they were within 6 feet of someone who had COVID-19 for a total of 15 minutes or more, or they're taking care of a sick person at home, or had direct physical contact with a person who is sick with COVID. People who are quarantining or keeping themselves at home after contact need to watch for fever, cough, shortness of breath, and other symptoms of COVID. And the question also included a part about testing. And the reason that testing may not be a totally effective strategy for someone who is exposed is because although most people get sick or have symptoms, if they're going to have them, within about 2 to 5 days after exposure, we have seen enough cases where someone becomes ill up to 14 days after that exposure. And that's why that time period is so long. Our last question is, once we return to the workplace, what are the triggers for shutting down again, especially if local governments do not require workplaces to shut down? So there are a number of factors that could affect whether a workplace closes after reopening, even if the local policy allows it. And that includes that there's an outbreak of illness with 2 or more staff members at the workplace, whether even though the business tried, there's an inability to successfully implement the mitigation measures, or that a high level of staff or the business leadership are dissatisfied with the new policies and procedures and just can't stick to them. So I hope I've answered your questions. If you have more questions or you'd like to ask clarification on one of these questions, feel free to reach out to DRI or me. I'll be happy to answer them. Thanks so much.
Thanks once again, Dr. Kooning. I think you've given us a lot to consider as we plan to return after the COVID-19 pandemic. If you'd like more information on how to safeguard your organization, register now for DRI's online Pandemic Preparedness for Organizations workshop. Topics cover everything from starting to think through the differences in a pandemic-specific plan to exercising and maintaining such a plan. Upcoming course dates include January 11th and March 23, 2021. Click on the link on your screen for more information. And if you'd like to set up a group training session for this or other courses, give me a call at 240-486-5371. If you still have questions that we haven't covered, give us a call at 866-542-3744. A recording of this, and in fact, all of our webinars, is posted on DRI.org. I'm Russell Wooldridge, and this webinar has been a production of DRI International 2020, all rights reserved. Thank you for your attention.